Now we will come to ventricular rhythms. In this section, we shall study idioventricular rhythm, ventricular tachycardia, and ventricular fibrillation. This ECG shows a very slow rate of 32 per minute. This is a ventricular rate. A ventricular pacemaker's rate is between 20 to 40 per minute. Now let us observe the beat closely. There is no P wave. The QRS complex is 3 mm wide, suggesting ventricular beat rather than supraventricular. A mid-nodal rhythm would also be very similar without a P wave, but the rate will be between 40 to 60 per minute. This is idioventricular rhythm. There is absence of P wave, wide QRS complex, and rate between 20 to 40 per minute. In this ECG, the QRS complexes are very rapid but broad and bizarre, indicating that the impulses are originating in the ventricles. There are no P waves. RR interval measures 6 small squares, that is, the ventricular rate is 250 per minute. This is ventricular tachycardia. It is common after myocardial infarction due to formation of circular circuits around the ischemic area. It is very alarming as it will lead to ventricular fibrillation and death. This ECG shows no proper QRS complexes. There are just coarse, chaotic undulations. This is ventricular fibrillation. It has to be corrected immediately with DC conversion shock, otherwise death will occur. Note the coarse undulations of ventricular fibrillation. Note the wide QRS complexes occurring very regularly at a rate of 75 per minute. This is a pacemaker rhythm. Since the pacemaker is placed in ventricles, the QRS complex is wide, like ventricular beat. Now note the P waves. P waves are seen at regular intervals and bear no relation to the pacemaker rhythm. The condition is complete heart block on pacemaker. We will be studying the heart blocks in the next chapter. Now in the chest leads of the same ECG, we can see a spike of pacemaker stimulation termed as pacemaker spike. Note the deep vertical spike followed immediately by a wide QRS complex.